Thank you very much. Let me just give me 1 second here. Keep it there. Thank you for being here this morning. The latest numbers, I don't have today's updated numbers yet, but these are as of yesterday. Massachusetts recorded 70,271 cases of COVID-19. That was an increase of 1,184 from the day before. The deaths total in Massachusetts as of yesterday, 4,212. It's up 122 from the day before. The cases here in Boston, we surpassed 10,000 cases. We have 10,241. That's up from the day before of 164. Actually, we surpassed it 2 days ago. And the deaths in Boston are 449, up by 7 from the previous day. Our thoughts and prayers are certainly with everyone who's struggling with this virus, who have family members that are sick or suffering in the hospital, and also the families who lost loved ones. Our thoughts and prayers go out to you. Our actions are focused on getting everyone the care and support they need and safety they need. The Boston Hope Medical Center is treating 166 patients, 81 on the respite side and 85 on the hospital side. Altogether, since Boston Hope has opened, nearly 600 subacute COVID patients have been treated at Boston Hope. That's allowing hospitals to dedicate more beds to intensive cares. And I want to thank all the folks that are helping us in that situation. In fact, the COVID patients in Boston ICU are gradually going down. Overall, our city's average of new cases has leveled off a bit. We're seeing some indications that they're going down. We're seeing that we're moving in the right direction, and a lot of that is because of the precautions that we're taking. But the curve is slowly bending. We're only beginning towards where we need to be, and we're asking people to understand that. We still have a long way to go before we can safely launch a recovery plan. We are working every day to build that plan with the state, with other cities and towns in the Commonwealth, with our industries and our communities here in Boston. Our goal are healthy reopening and an equitable recovery. The only way we're going to get to that point is by staying focused on physical distancing and safe practices. That allows us to slow the spread of the virus one day at a time. The state order on face coverings goes into effect today. We've had an advisory in place for a while in Boston, and most of us have it down. Whenever you leave your home, you should be wearing a face covering. If you remove it for whatever reason, we're asking you to put it back on when you take it off, whether it's to pack a car or groceries or what have you. We're asking people to cover your nose and your mouth, not just your mouth, but your nose and your mouth. And when you're near or anywhere near other people, we're asking you to make sure that you have the face covering on. That's what the protection's for, and that protects you and other folks from people that might be carrying the virus. The state policy allows fines for noncompliance. I've heard many questions about this and what Boston's going to do. Certainly we're looking at the situation, but we've heard and witnessed and read situations in other parts of the country where enforcement has been uneven or even inequitable in communities of color. I want to assure the residents of the city of Boston, the purpose of our guidelines is to empower and keep your families and your community safe. Our approach is to support you, not to punish you, especially if you're already financially struggling. I also want to let the disability community know that we are also aware of your concerns and committed to supporting you. The state order includes exemptions for those who have breathing challenges, those who rely on lip reading to communicate, and those with certain mental health diagnoses. If anyone needs help finding or making a face covering, please, we're asking you to call 311. Our focus for compliance will be building on where the public visits mostly. We want to make sure that everyone inside a grocery store, for example, has their nose and mouth covered, both as going in there shopping. Any store that is open should be requiring this. These are the signs that we're going to be putting up in businesses and business districts and distributing to stores all across our city, helping us stop the spread of the infection. They cover all the basic goods, safe hygiene practices. The more people who follow these guidelines, the fewer infections that we'll see, and the sooner that we can move forward. So when you see these, if you could take a chance to take a look at these and read these signs. Today I'm also going to provide some updates on our plan to expand COVID testing in the city of Boston, our relief for small businesses and veterans, and our food access for residents of Boston. I'm going to start by outlining our expanded testing. Testing gets individuals the care they need to get well and to avoid passing on the virus. It allows our public health experts to track the outbreak and inform our response. Testing also plays an essential role in our progress towards recovery. It provides the data that we need to move forward in a phased reopening. Public health models tell us the more testing we can do, the more we can reduce our positive infection rate and give us the data and the confidence that we need to move forward safely. We have significant increased tests in Boston last week, working with our hospitals, working with our community health centers, and investments with the Boston Resiliency Fund. Today I can share our commitment to meet a new testing benchmark and our strategy to get there. Our goal in the coming weeks is to reach at least 1,500 tests per day in the city of Boston. Before last week, we were testing less than half that rate. And even after a significant increase last week, we are still hundreds of daily tests short of the 1,500 mark. So we certainly have some work to do, but we have a plan to get there. We'll be launching a multi-pronged approach. First, we're going to keep expanding testing at community health centers. The Boston Resiliency Fund has dedicated over $1 million to expanding testing at access to community health centers in neighborhoods all across the city of Boston, starting in our more severely impacted communities. This week, we're moving forward with testing at 2 centers in Jamaica Plain and 1 center in Charlestown. Overall, our goal is to increase testing by 50% across all of our health centers within the next month, while at the same time expanding our partnerships with the hospitals. Second, we are going to expand mobile testing capacity in the city of Boston. This will help us fill gaps for certain neighborhoods and in environments where the risk of transmission is the highest. We'll launch that work this month with a goal of testing at least 150 people per day, and that van will be operational 6 days a week. Third, we'll conduct surveillance testing for groups at risk of faster spread and more severe impact. That means testing everyone in a select population to monitor infections and provide response over time. We started with universal testing for our homeless community here in the city, which will soon be completed. We then began universal testing for high other impacted populations and sites, including our first responders. Ultimately, the goal is to repeat testing for key populations and locations on a rotating basis as we reopen and the recovery moves forward. We're also continuing the antibody testing, which is key to understanding the path of the virus. This week, Mass General Hospital completes testing in our 1,000-person study. We'll have the data to share next week. After that, we'll move forward with antibody testing for first responders and other key populations in the city of Boston. As we move forward, we're going to be in conversations with the state on testing resources and also to advocate for measures like testing capability in primary healthcare settings and broaden the criteria to allow more people to get tested. In all of this work, we'll prioritize equity with a target outreach across communities in multiple languages. You can continue to get up-to-date information on maps for testing and go to boston.gov/coronavirus, or you can call 311. We also want to remind everyone, please remember to call ahead to be screened or scheduled for an appointment. Don't just walk into the health center in your area that has one. Make sure you call ahead. As we work to get into a position to begin reopening, we're also working to support our residents through various disruptions and hardships this crisis has been causing people. And I have some updates on financial relief. As we all know, small businesses are the backbone of our neighborhoods and our economy here in Boston. They represent many people's livelihoods. I'm grateful to the owners and employees of our small businesses for the work they do and the resilience that they have shown to date. We are dedicated to providing relief effectively, efficiently, and equitably to all of those businesses. We have long established equity focus in small businesses and financial empowerment policies, and we have a team that's engaged on the ground, online, with the needs of our neighborhood businesses. We started with a $2 million fund for our Small Business Relief Fund. We use that to provide grants to 561 small businesses that are impacted by the COVID pandemic. Now, certainly we know that $2 million doesn't go far. We're adding an additional $5.5 million to fully fund all eligible grant requests that are submitted during the application process. that combines newly available federal funds from the Department of Housing and Urban Development, as well as commitments from the Citizens Bank and Eastern Bank. And I want to thank them for their support. And I know that the money that we're putting in doesn't cover everybody. And we're looking at how we can help every business in the city of Boston, and to get some help, and some of it might not be financial relief, it might be technical support relief. We're asking you to contact our Office of Small Business. I can also announce a new partnership today to empower small, local businesses to provide food to residents in need. Commonwealth Kitchen is a nonprofit here in Boston that helps local food businesses launch and grow. They're a longtime partner to the city. They had to adjust their operations in March due to this crisis. They've been shifting the focus on emergency food relief through a program called Common Table. They're working with local, minority-owned restaurants on a plan to feed people by delivering meals in sites and groups to residential settings. We're going to support this program with significant grant from the Boston Resiliency Fund, as well as a partnership with our Office of Economic Development. Commonwealth Kitchen has been there for our most vulnerable communities. We are happy to support them in this work, support more of our locally owned businesses, and expand our food resources for people who need it. In total, the Boston Resiliency Fund has raised over $29.4 million from nearly 5,500 donors. We have now distributed over $16 million. More than half of that has gone to food and basic needs for children, families, and seniors, and millions more to vulnerable populations, frontline responders, and testing access. For meal sites and families looking for meal sites, we're asking you to go to food resources, the food resource section on the boston.gov/coronavirus website. That's boston.gov/coronavirus, or call 311. A special word for our military veterans and families. Our Veterans Service Office is fully operational and there for you. We continue to provide financial assistance through a state-local partnership under Chapter 115 of the Massachusetts General Laws. Benefits include financial aid for food, housing, clothing, and medical care to veterans with limited incomes and to their dependents. It can also include a monthly assistance, medical reimbursements, as well as emergency help paying bills. Veterans and their families can apply on our website at boston.gov/veterans, or you can reach out to the guidelines by calling 617-241-VETS. That's 617-241-VETS. A few reminders before I wrap up. One of them, if you're having a medical emergency, we're asking you to please call 911. That's 911. EMTs and hospitals can treat you. They have the capacity and they have the ability. They are safe and they're there for you. Secondly, please, when you discard your gloves, masks, or face coverings, do it properly. I'm still hearing reports of gloves and masks on streets, including outside meal sites, in grocery store parking lots. This is not sanitary, and it's not fair for those who have to clean them up. And lastly, I want people to remember to fill out the U.S. Census form. I talked about the federal funds that we're using to support small businesses. They also are true for programs that serve children, seniors, our veterans, renters, and many other needs. The federal role may even grow more important as we move through this crisis into recovery. Those funds get distributed based on population. So you have to get counted to get a fair share. It only takes a few minutes to fill out the form that you get in the mail, or you can do it online at my2020census.gov. That's my2020census.gov. It's safe and it's secure for everyone to fill out. You can also call 311 if you need guidance or more information. I'll conclude as usual with some thank yous. Earlier today, we had an F-15 flyover by the Massachusetts Air National Guard today for our healthcare workers. I don't know if I can say thank you as dramatically as that, but I'm going to try. Today marks the start of National Nurses Week, and today is National Nurses Day. No one is working harder than our nurses right now, and no one is more indispensable to our community and to our country than nurses right now. Great compassion, health care depends on great professional nursing, and we have some of the best nurses in the world. So I want to say thank you, and on behalf of the people of Boston, we want to say thank you. To the nurses working in our emergency departments, intensive care units, and every other department in our world-class hospitals. The nurses at our Boston Hope Medical Center, the nurses working in our community health centers, the Public Health Commission nurses, nurses working at Boston EMS, our school nurses in the Boston Public Schools, nurses in long-term care facilities, assisted living nursing homes, shelters, and VA hospitals, psychiatric nurses, visiting nurses, traveling nurses, nursing assistants, nursing students, nurse practitioners. Whatever your role, wherever you are working, whoever you're caring for, we depend on you and we are grateful for you. Now thank you for your great service. I have one question, I believe, that was submitted early. I'll do this question and then I'll open up for questions from the reporters that are here. The question comes from Catherine Carlock from the Boston Business Journal. It's a two-part question. What's the latest update on a slow reopening of Boston's construction industry? Are there any specific projects or types of construction you consider allowing to move forward before others? The latest update on our construction industry is that all active work is still currently limited to essential projects only. All of these sites have been required to provide safety plans, a signed affidavit to the City of Boston confirming that the safety plan will be followed. We're involved in the construction industry in our current conversations about what the future reopening looks like, and we'll have more to share on this in the coming weeks as we move forward here. With that, I'll open up to any questions here. Karen.
I don't necessarily have a question. Yesterday, there was a significant protest in the State House. As we have to wait for these closures, and we have to wait for reopenings, as we have to continue to social distance, that's probably going to happen again. What are your thoughts on this as this continues to push?
The question is on the demonstration at the State House yesterday about reopening the economy. Certainly I see everyone's point. As mayor of the City of Boston, I've said this several times. When you close the economy, it's detrimental to a city, and it's damaging to our budget here at City Hall. It's damaging to many other cities and towns. And there's nothing more than I'd like to have happen, or the governor or other town managers and city councilors and mayors around the Commonwealth, around the country, quite honestly, is to get our economy up and running. But as I said very early on, we've had over 4,000 people have lost their life here in Massachusetts due to COVID-19. It's a very highly contagious disease, a virus. It's a worldwide pandemic. I was on a call earlier with mayors from around the world. We're all grappling with the same situation and the same concerns that we all have. And I think that for everyone, including the people that were protesting yesterday, I think my job and the governor's job and all of us as elected officials and leaders is to protect them and to make sure that as we think about reopening society, that it's done thoughtfully, done with proven metrics and data, done carefully, systematically, and I think most people understand that, and certainly that I hope that the folks that were demonstrating yesterday, I appreciate that's their right for freedom of free speech, and I appreciate that, but I also hope they understand that many people have lost their life here due to COVID-19, and many more people are going to lose their life, and our job is to make sure that as we return back to our job and return back to our life, that it's done very carefully. And I would just ask them to consider that.
As these protests popping up, will they be tolerated in the city? I mean, we're talking about gatherings, certainly.
The question is, will they be tolerated in the city? As long as they do it in a respectful manner and they don't disrupt people's livelihoods and don't cause a public safety issue. Of course that. I mean, people have a right to demonstrate if they choose. We just ask, and yesterday was calm. I mean, it certainly wasn't some of the images I saw around the country. It seemed pretty calm. People had signs and people expressing their opinion. I appreciate that. I just asked them as they're doing that, think about, we're not doing this because we want to do this. Shutting things down is not something that as a mayor you want to do. I've been criticized in the past of going too big and too much. And certainly the last thing I want to do is close things down.
Ban on gatherings of more than 10 people, is that enough for those outside?
That's a good question. The question is, if there's a ban on gathering of 10 people, does that basically refer to folks gathering outside? It's a recommended ban. It's a recommended advisory the governor put down. So I don't believe it's mandated. It's a recommendation for people to keep themselves safe from people who might have the virus or people that don't have the virus but are carriers of the virus. So that's what the recommendation. The stay-at-home order is an advisory.
Playgrounds and things along those lines.
Yeah, again, the playgrounds are closed. So if they're in a playground or they're in a place that's closed, that's a different situation. These ones are on, if I saw correctly, they were in front of the State House on Beacon Street. On a public street or public space is different. When you're on a, if you're going to do a demonstration in a playground or a park, you need to apply for a permit. That's okay. Any other questions? All right, everybody. Thank you very much.